Hi, everyone. Welcome back to another episode of The Power to Prevent. This is the podcast where we talk about HIV, how to prevent it, and how these prevention methods can change lives. My name's Tomike, and in this podcast, we bring on different guests to talk about their perspectives and experiences with HIV. So I will hand it over to Megan to introduce and tell us a bit more about The Power to Prevent and the PrEP project.
Hello, thanks, Tomika. So I'm Meg, and I am a sexual health lead at BHA for Equality. And the PrEP project is a project that runs to increase awareness and uptake of PrEP in Black, Asian, and minoritised ethnic groups. So we do lots of things. We do the podcast. We have a fast track service where we can fast track people from different communities into the Northern Sexual Health Clinic and make the process easier of getting PrEP. And then we do lots of different promotional activities and group sessions as well.
Okay, and joining Megan and I today is another member of BHA. So we have Bothwell, and thank you for taking the time to come onto our show and have a talk with us today. But do you want to tell the listeners a bit more about yourself?
Thank you. Thank you so much. And you forgot to mention I'm the first man on this podcast.
My
So
bad,
yeah,
you are. Honored
lovely
position.
to
Class,
be
man. Who better to do
represented.
it?
Yeah, so my name is Bothwell, sexual health lead with BHA for Equality, same as Mag, and I cover Greater Manchester, parts of Greater Manchester, Salford, Rochdale, and Tameside, and then also do some work in Liverpool as well.
Okay. So I think we all know each other quite well, and the listeners have gotten to know a bit about us. But just to give anyone who's maybe a first-time listener a bit of an introduction, Bothwell, would you be able to tell us the basics, like the ABCs, what HIV is, how it's treated and prevented, and stuff like that?
Thank you. So, HIV, I think we have to start with like the definition, HIV. So it's basically, in simple terms, human immunodeficiency virus. And I always like to say the key part about HIV is around the immunodeficiency part, where we understand it in the concept that it's a virus that attacks the body's immune system, specifically the CD4 cells, which play a huge role in fighting against infections that may want to harm your body. So this is in relation to the immunodeficiency part of the definition around HIV. And without treatment, HIV kind of reduces the number of these cells that make it harder for the body to defend itself. And I think the most important thing to know about HIV is that it's manageable, especially nowadays with modern treatment that we call antiretroviral therapy. I mean, people can live with HIV, live long, healthy, and happy lives.
Thank you, Bothwell, for explaining it because I think, a lot of people might not, we talk about HIV is so common in our conversations, well, at least
Yeah,
in mine, I talk about it probably more than the average person, but it's so common in our conversations, but a lot of people might not actually know what it is. So I think it's good for the listeners to get a basic breakdown of it. And
definitely.
yeah, Megan, because you run the PrEP project, I think it'd be suitable for you to tell us a bit more about that and how that fits into HIV and, kind of prevention of spread and things.
Yeah, so like Bothwell said, it's HIV is a virus. So the way that it's transmitted is in different ways. So for the most common way is through unprotected sex. It can also be transmitted through like injecting, so needles, unsterilized. And but yeah, as I said, the most common is unprotected sex, and PrEP is a pill that can prevent that transmission. So PrEP you can take in different ways. So it depending on the kind of sex that you're having, you can take it in different ways. So you can take it daily. So it's just a pill that you take every day. And if you take it every day, then you'll be prevented from acquiring HIV. You can also take it what we call events based. So that is around the times that you have sex. So for example, one of the ways of doing this, if you're having anal sex, is what we call the 2-1-1 method. And that includes taking a double dose, so two pills, and then that's 2 to 24 hours before sex. then one pill the day after, and one pill the day after that. We also have a 2-7 dosing method. So that's recommended for people who are having receptive vaginal or frontal sex. And so that's a double dose again, 2 pills, 2 to 24 hours before having sex, and then one pill a day for 7 days after that. And PrEP is obviously can prevent HIV, but it doesn't prevent against other STIs. So one of the ways that we say, well, that you can prevent acquiring HIV is through using condoms. And that will prevent against other STIs. PrEP itself is just for preventing HIV.
I didn't know about the different dosing regimes for the different types of sex you're having. That's really interesting. I thought a lot of people would probably just take it every day or just around the time. So that's a really good breakdown for me to have and the listeners to have. So I thank you.
Yeah, I think it's great because, not everybody wants to take something every day or might not feel that they can remember to take something every day. And it's a really good way of, if you're just having sex occasionally, you can have PrEP at home. Like once you've got your prescription, you can have it and you don't need to use it every day. You can just use it when you're going to have sex. So if you're going out on a Friday night, you can take PrEP the day before on a Thursday or a couple of hours before you're going out, and then you can take it for 2 days after or 7 days after, depending on the dosing method that you're using. But yeah, so people could just take it at the weekend if they're going out at the weekend. You don't need to take it every day, which is really great.
Yeah, interesting. So Meg, is it for everyone? Can everyone take PrEP?
Yes, so anyone can take PrEP. As I say, the only thing that's different is the dosing methods, but anybody can take it. You can get PrEP from a sexual health clinic. And as I said earlier, we have a fast track service. So if you're from a black community or an Asian community or anyone who is from a minoritized ethnic group, we can fast track you into the PrEP service at the Northern Sexual Health Clinic. And that just makes it quicker and easier to access PrEP. But yeah, good question. Everyone can have it. I think there's been some miscommunication or misunderstanding in the past that PrEP is only for certain communities, but actually the guidance says now that if somebody has an interest in PrEP or they think they might need it, then they're absolutely welcome to have it. And in theory, that's what should happen. So yeah, anyone can have it.
This is a bit of a loaded question, I guess, but where do you think that miscommunication or like the misinformation around only particular people from particular communities can take PrEP? Where do you think that kind of comes from, or how does it kind of persist today?
Yeah, I think so. I guess historically, HIV, particularly, in this country, has been associated with men who have sex with men, gay and bisexual men. And that meant that, a lot of narratives by sort of public media and things can focus on that community. And of course, in within that there is some importance in it, absolutely. And initially when PrEP was first developed in trials, the people that were took part in the trials were majority men who have sex with men and a few trans women, but were 80% white British. So, people from black and Asian communities weren't widely integrated into those trials. And so I think that might have led to certain perceptions with health professionals or media, just public opinion really, that might have led them to think that it is only for certain communities. And at the beginning, it was only available to certain communities, but now it is available for everyone. So you can get PrEP no matter what, as long as you have an interest in it or you think you might need it, and then you can get it. So in theory, so that's why it's the education part of it really that is a big thing, which I suppose you will see out in the community as well, won't you, Bothwell? It's like that
Yeah,
education and for people who say, "Oh, I never knew this was a thing." So,
yeah. And I think most importantly, it's not so much sometimes around PrEP itself as a pill.
mm,
That's another thing. But the idea that there's a close link between taking PrEP as a method of preventing HIV and that same PrEP having, many similarities to HIV medication. So many people would assume and would actually say you're taking HIV medication. And once that comes into play and once it forms part of the discussions, we go back to the stigma around people living with HIV. We've had stories around, for example, someone saying, "Oh, I went to my girlfriend's house and I found, HIV medication," which sometimes is PrEP medication, which is the PrEP pill, and
Mm.
that the stigma around that sort of discussion. And we also look at, for example, we call it HIV now, but then many parts of the world have always referred to it as AIDS. And what that brings into play is the stigma around AIDS. And we, for example, know that we've come a long way. We know there's late stage HIV and it's manageable. And we have beautiful things like PrEP. But many parts of the world, even up to this day, still live in a time where there's still that stigma around HIV and AIDS, and the community still shuns people, who are associated with HIV or AIDS. So any medication, in effect, that you're taking, be it PrEP or even the antiretroviral medication, there's that stigma, that fear that this person is on treatment.
Yeah.
And I feel and think also that this fear is around the belief that if you have HIV, you're definitely going to pass it on to the next person, you know. But then we've come a long way, and this is
Yeah.
no longer the case. That is why I feel we should be focusing really on the idea of U equals U, to say if you have HIV and you're on, your medication, you're taking your medication well, you will not be able to pass HIV on to the next person.
Yeah.
I still feel that this is knowledge that most people are not aware of. Every time I have these discussions in the community, it's always really.
Yeah.
And then I ask myself, what have we been doing? If so many people don't know about this basic fact, what have we been doing? So I think
Yeah.
it actually shows that we have a long way to go, and we need to focus really more on the idea of U equals U. The fact that if you take your medication well, you reach a level where you will not be able to transmit it on to the next person, even if you have condomless sex.
Yeah.
That is a miracle. You know what I'm
Mm.
saying? And also the idea of PrEP in itself, explaining to people, for example, I always try and give people what ifs if I'm talking about PrEP. Like, what if? Can you think of a time where, imagine a scenario where we have a pill in the future that if you take it well enough and then you have intercourse with someone who's living with HIV, you won't get HIV. And people are always like, oh, wow, that would be so great. I'm like, it's already there. You know
Yeah.
what I'm saying? So I feel that the stigma around PrEP, it's far reaching. It goes way back to the early 2000 era or late 1990s,
Yeah.
where we had a lot of people facing really difficult challenges because of gaps in systems right around the world. And our experiences differ from, depending on where we come from.
Yeah.
And also it's also linked, I think, to the early approaches that we had around HIV prevention, where it was a bad thing to have HIV, you know. It was a bad thing and would put out those images of frail looking people, and we made it look scary to have HIV. So that stigma has stayed with people for a long time.
Yeah.
And we have a long way to go. We have a lot of work to do in terms of readdressing those challenges, readdressing and really allowing people to view this differently, to see that there's a lot of hope. We've come a long way and things are really different.
Yeah, absolutely. And I think, fear is an emotion or a feeling that lasts for a long time, isn't it? And when people are scared of something and when, like you say, that's been instilled, that stigma lasts a long time. And I also think it's interesting what you're saying about U equals U, because, if you think about it now, the focus, like in the late 80s, 90s, and into the 2000s, was on finding that cure, was not cure, sorry, finding that U equals U, finding medication, treatment. And now that we have that, the focus now can be on prevention. And obviously, prevention was just as important then, but now it's like, look, if you acquire HIV, you'll be treated for it. You will live a long and healthy life just like anybody else. What we can do now is focus on prevention and stigma. Those are the two sort of battles, if you like, of the work that we're doing, because we no longer, we know now that once HIV has been acquired by somebody, that they can be treated for it. And that for a long time was a huge and really urgent focus. So the fact that now you can take something like PrEP and that can be in your control. You don't know, the status of somebody that you're having sex with, but what you would know is that you're taking PrEP. And actually that shifts the focus from people living with HIV and the stigma that they face onto thinking, well, I make my own decisions about how I protect myself. And if I take PrEP, then I know that then I'm sorted then. Do you know what I mean?
Definitely, definitely. And um, I like the idea of empowerment as well.
Mm,
Because we 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 have many ways of preventing HIV, right? And I believe with PrEP, we've sort of unlocked a new stage, you know. So I always give examples like and people always ask, for example, if we do have the condom, why then are we talking about, why then do we have PrEP as a new method? Is it not something that you want to test on us, And it brings again fears around um, the medical system as a whole, Are you not trying something new on us? Are you testing it? Is this a test on me? That sort of thing. And we've come a long way that I feel with PrEP, we have so much potential.
mm,
And what has been happening is that it almost feels like it's been a secret, to say there's a thing called PrEP or PEP. It's been treated like a secret, this life-saving secret that we don't want to talk about, this life-saving secret that not everyone can have access to, you know, and that is why I think we should make as much noise as possible, as much noise as possible. Do you know how, for example, if you have those adverts that we see on TV and how easy it is for us to know, oh, they're talking about this. If I say, for example, Domino Hoo Hoo, you know what I'm talking about.
yeah.
So what that means is I feel in terms of marketing, something was done strategically, something was done well to a
Mm,
point where we all know what we're talking about. We all
yeah.
know what it is, right? But then we have a life-saving pill that, I feel is still a secret. So I think we have to really sit down and do something big and crazy and out of this world. Try and remove, the idea of because there's a lot of medical fear around PrEP, sort of like gatekeeping, if you want to call it that. And I feel like we need to remove that in our attempts to provide awareness, to bring PrEP awareness to people. And I feel that PrEP is a game changer, and if we want to do away with stigma,
Yeah.
right? If, for example, I have a partner who's living with HIV, or a potential partner, and then I know that if, for example, they're taking their medication well, there's U equals U, um, I'm gonna be okay. Or if I decide to go on PrEP as well as a way of protecting myself, I'm still gonna be okay. That's going to remove the stigma
Yeah.
around HIV and the fear around HIV. And I always say, sometimes if you watch Formula One or those racing videos, um, it seems like they don't have fear, right? But then there's a thing that kind of protects them, which is they have a seat belt. They know that this car has, airbags and so on. They know that they have the comfort, the feeling of comfort to say, I'm protected, I'm safe. So they act fearless, knowing that they have a method of protecting themselves. So I always say, with prep, it gives you that feeling as well to
Yeah.
say, no matter what happens, I know that I'm going to be okay, right? I know that I'm going to be safe. And the same with U equals U. If you take this, actually helps you to take your medication as to kind of adhere, because we've had challenges, especially in the onset of HIV uh, treatment, where adherence was a problem. Um,
Mhm.
you know, taking one pill and then remembering to take that pill. People had different challenges as well around access to antiretroviral treatment. But then just knowing that there are benefits to holistically taking this pill, it will kind of, I feel, push people to want to take the medication more, knowing that if I take this, well, I'm not gonna give another person HIV, or my partner is gonna be safe and I will live a healthy, normal life.
Yeah. And I think prep allows us to move away from that risk language, doesn't it? Of and like you say, if you've got fear and if you're feeling like when we speak to people about HIV and we use risk language, risk-based language, it keeps up that fear. It that doesn't get rid of it. But like you say, the empowered thing of like, if you're taking prep, you're rather than saying it's eliminating risk, it's empowering you. You're making a choice there to know that when I go into this situation, when I have sex with somebody, I know in myself that I'm protected. And I think that can positively change our sexual behavior as well, because we can have sex and not be worried about something or not have fear about something because we're taking this medication, and that's all there is to it. So I think it actually can, make that experience nicer for people, and eliminate some of those fears that people have.
Yeah, safe sex is great sex.
Exactly.
Mhm. You guys have spoken in great depth, and thank you about how effective prep is. It's so effective, but
Mm,
we don't know about it. Even in some of the social circles I hang out with, they don't know about it. They don't know about U equals U. And not because, they're ignorant or they don't care to know, but it's we don't really you don't really hear it in everyday conversation. So it keeps particular people out of that conversation. So what kind of things do you think that we can do on an organizational level that people can do in their day to day to help bring it as part of the conversation and make people more aware?
Yeah, I think we we have been doing quite a lot of work, and there's always potential. And I think the beauty of BHA and the work that we do is embedded in our ability to dive deep into the community, if I may say. I think we are in places where um, it's rare for you to find people talking about these things, but we manage to place ourselves in those strategic positions, and the ask is always for us to magnify and to do more each year, find new places, talk more about it. Um, one of the best ways to do away with stigma around HIV is to really talk more about the new inventions that we have, the progress that we've covered, and preaching the gospel of um, HIV not being a death sentence like back in the day, you know, and we just need to talk about it, shout, cry if possible, as long as people can hear what we are trying to say. And I believe that a lot of people will appreciate the message that we continuously try to preach. So reach more communities, diverse communities, anyone that we think does not have access to this kind of information and support. And sometimes it has to do with the language, for example. Um, are we giving out the information in a language that everyone understands? You know, and the good thing about BHI as well is we try and tailor our services to suit the needs of the communities that we serve, you know, and we try and make this as part of everyday conversations as possible. And I feel the most important thing as well is not to isolate discussions around PrEP and prevention. So more times, more often, you will encounter people that have other problems beyond sexual health problems. And because it's a sexual health discussion, people will not place sexual health discussions at the top of the pile, in terms of priorities. People have economic challenges, people have housing problems. And I feel we need to continuously package information around PrEP and HIV prevention, along with all other services. You know, we package it in a way that resonates well with people. We have to be part of the community. We have to participate in the activities that they do. We have to be one with the people. And like I said, shout, cry if it's possible, as long as more people hear what we're trying to say and more people understand the benefits and the journey, that we've walked in terms of HIV prevention.
Mm.
I really appreciate, like, I really appreciate first the answer, and then also um how you were talking about, packaging it with other messages as well. So it's not just you need to take prep and here's why you need to take prep, because then people might kind of turn away from it, or because it's not your everyday conversation, so people might be a bit more reserved about it. But I think it fits in nicely to what, well, I won't speak for Megan, but kind of what the idea you had for this podcast in the first place about empowerment, and how prep isn't just, it's not just a medical pill that you can use to help prevent the spread of HIV. It is, but it's so much more in that it empowers you to take control over your life. It fits into themes of, like, self-worth, and, self-love, and, like, just protection for yourself and for the community around you. And it ties into community and looking out for the people next to you and the people around. Like, it ties into so much. So I think you're so right about that message not being isolated, in that it's health and how your sexual health fits into your physical health, that fits in with your emotional health. So I do think that's a really lovely point to round it off on. So thank you.
Yeah, yeah, definitely. And I think the danger is always around. For example, if you're talking about PrEP or sexual health or HIV prevention, um, the mind is going to, whether you like it or not, the mind will rush to the genitals. You know, essentially, we'll be talking about sex. And once we start talking about that subject, um, there are a number of challenges around having open discussions around sex and sexual health, where sometimes it's difficult to have those conversations, with some people around, relatives and so on, because we come from different cultures, we come from different religions, you know. So it's going to be hard for different people, but we need to constantly package it and repackage it to suit everyone.
Yeah.
That's why you find every other product. I'm always amazed at how marketing geniuses do their work. You'll find the same product, but then it's always packaged differently, year in, year out. But it's
Yeah.
still the same thing, still the same car, same engine, but then they just changed the color. And what do you know? You're gonna buy, spending £5,000 more. You know what I'm saying? So we constantly need to repackage um, PrEP as long as it suits, different populations. Some people are so comfortable talking about sex and sexual health that you need to say, okay, this we're gonna talk about sex, and they're gonna go like, yay. So the idea, I think what I'm trying to say is the messaging has to suit the respondents. You
Yeah.
know, there's a saying, I don't know where I read this, where it said, um, the substantive dog wags the methodological tail. Where did I learn this?
Oh.
So it's the dog that wags the tail, not the tail that wags the dog. It's the dog that wags the tail. So
Yeah.
yeah, so it's the people that you serve that will determine the product that you're going to give them, how you're going to package prep information.
Okay.
I
Right.
see. You
Not,
lost me at first, but I'm there.
Yeah, no, just a little bit, but then you got it back.
I don't know where I read this. I must have been in college or something. I don't know, but then it kind of, yeah. So Package prep information to suit the right people, whoever they are. It cannot be packaged just one size fits all. It never works.
Yeah, that's
Yeah.
so real. Well, I see that we're coming towards the end of our time on the podcast, but it's been really amazing to have you on, Bothwell. I think you've opened up such a interesting line of conversation and you bring such a fresh perspective. Maybe it's because you're the first man, I don't know. But you bring such a
Magic,
fresh
magic.
maybe. But you bring such a fresh perspective and like you're very grounded in your outreach work because you can tell from the way you speak and the conversations that you bring here. Um, yeah, because for me personally, I'm from more of an academic background, so then I don't get much of the outreach side. So I think it's really interesting to see what it's like the conversations that people are having around prep. And yeah, it was really enlightening for me. And Megan, yeah, it's your podcast, you know, you always bring such a fresh perspective, and it's always really nice to have these conversations. So thank you for
Thank
coming
you for
on.
having me. Thank you for having me.
Thank you, Bothwell.
And do you have any messages for the listeners, any take home messages?
Um, just be selfish when it comes to your health.
Mm.
It's your health. It's just your health. So whatever you can do to prioritize your health, um, it's never late to, book an appointment to get a check, whatever it is. It can be anything besides sexual health, but you have to be selfish enough to make sure that you prioritize testing, even if you don't have symptoms.
Yeah.
And this goes particularly to all my men out there. Let's not wait for symptoms. Um, just prioritize and make sure you think of the people around you as well.
Mm.
And the beauty about prep, I think that we've been talking about is it's going to protect yourself and especially the people around you. So um, be selfish for
Yep.
once.
I like that.
Same. Well, thank you guys so much for coming on. Thank you for the wonderful conversations we've had today. And thank you guys, the listeners, for listening in. We'll be back with another guest, another conversation, and we hope that you will join us for that too. So, thank you, everyone.
Thank you.